Developmental dysplasia of the hip denotes aberrant development of the hip joint and results from an abnormal relationship of the femoral head to the acetabulum. For imaging assessment of developmental dysplasia of the hip, ultrasound is the modality of choice prior to the ossification of the proximal femoral epiphysis. Once there is a significant ossification, then an X-ray examination is required. A single AP radiograph is the most appropriate examination in children where femoral head ossification has occurred. Asymmetry of the femoral head ossification center delayed on the abnormal side is often present. Determine the relationship of the proximal femur to the developing pelvis. The femoral head should be centered in the inframedial quadrant defined by the intersection of Hilgen-Reiner line and Perkin line. Interruption of the Shenton line may also be evident. Perkin's line is drawn vertically, though the lateralmost aspect of the acetabular roof, perpendicular to Hilgen-Reiner's line. The ossified femoral head should be located in the inframedial quadrant created. Shenton line along the inferior aspect of the superior pubic ramus and the inframedial femoral neck. Here are some cases with examples on Z showing developmental hip dysplasia. The femoral epiphysis here in this case is smaller on the left and there is an underdeveloped, shallow left acetabulum. The femoral head is laterally decentered and is almost certainly fully dislocated. Features are of developmental dysplasia of the hip. Here in this case, shallow bilateral acetabula. The femoral head epiphyses have not yet ossified, however. The expected positions of the cartilaginous heads appears dislocated on the right and laterally subluxated on the left. Here is untreated case of bilateral developmental dysplasia of the hip. The acetabuli are severely hypoplastic on both sides, with superior displacement and pseudo-articulation of the femoral heads with the iliac bones, as well as deformity and advanced degenerative changes, which are more pronounced on the left side.